So welcome back to Monitoring Clinical Trials at Wake Tech. My name is Steve Pope. This week we're going to be talking about reviewing the investigator's site file. So let's first of all take a look at the purpose of what we're doing this week. The investigator/institution should maintain the trial documents as specified in essential documents for the conduct of a clinical trial and as required by the applicable regulatory requirements. The investigator/institution should take measures to prevent accidental or premature destruction of these documents. This comes from ICH E6 R2 section 4.9 records and reports. So this is what we're going to be focusing on this week. Our learning objectives will be to review essential documents for regulatory compliance, to assess the investigator site file, or ISF, for completeness, to reconcile essential documents between the ISF and the trial master file, or TMF, and we're going to discuss the supervisory responsibilities of investigators, what they should do, what they're required to do, these types of things. So let's begin by talking about the investigator site file, or the ISF. This is also known as the site regulatory file, so you may hear it referred to as the regulatory file or the site binder or the investigator site file. All three of those terms are rather interchangeable and really describe the same thing. So what this consists of is you have a physical binder. In most cases, you'll have a physical binder, a 3-ring binder that contains the essential documents that are listed in ICH E6 R2 Section 8. And these may include other essential documents that may or may not be listed there, such as correspondence. They may print out emails and put them in there. They may have IP shipping records, packing lists, things like that, that they are contained in their investigator site file. So the important thing to understand is that this is either going to be, in most cases, a physical binder, a 3-ring binder, or some sites are moving towards electronic systems, and there are a number of products out there that are very good, that they can maintain these documents in an electronic fashion, and then as the monitor comes out, they'll give the monitor access to those files so they can perform their reconciliation. And then finally, these documents may be separated into other site binders. So for example, the site may have a pharmacy binder that contains all of the investigational product shipping records. It may probably will contain the accountability logs. They may have a laboratory binder that contains the laboratory information, and it also contains the CLIAs, or the CAP certificates, or the lab director's CV. Usually those are contained in the lab binder. They may also have a personnel or a training binder where they keep documents that are not specific to the trial, things like medical licenses, staff CVs, staff training records that are not specific, things like GCP training or IATA training, those types of things that are not unique to your individual trial. So you may find these in multiple places, so it's good when you get out there, if you can't find something, just ask the coordinator. If they filed it someplace else, they'll be able to tell you where they filed those documents. The next item that we want to define is going to be the trial master file. So our trial master file is kept by the sponsor or the CRO on behalf of the sponsor, if the sponsor is working with a CRO. And these are going to be basically the same documents that are in the investigator site file. They're going to be organized according to ICH E6 R2 Section 8. So all of those documents that you see, well, not all of them, because that section is going to identify which ones are kept at the site versus which ones will be at the site and in the sponsor's trial master file. These are kept electronically, or they might be kept on paper. However, most of them now will be electronically. Finally, these are shipped to the sponsor at the conclusion of the trial if the trial master file is kept by the CRO. And then finally, these TMFs maintain audit trails and the status of documents. So those statuses may be approved, superseded, obsolete, or draft, and that just indicates that which version of the document is the approved document. If you have a document that maybe was approved at one point but now is no longer the approved document, then it's been superseded. For example, a medical license that was updated during the course of a trial, the previously approved medical license would be then set at superseded. So this is something that is going to be done at the CRO or the sponsor level. This TMF is normally maintained by either an in-house CRA or a regulatory associate or some other person that's in the office for the CRO, and then it's the responsibility of the monitor or the CRA to reconcile the contents of the trial master file with the contents of the investigator site file when they're on site, because they're the only person that's going to actually see that physical investigator site file. So now that we've defined the differences between the investigator site file and the trial master file, let's start talking about what you're going to do when you're out on site and you're reviewing that investigator site file. So you're going to review essential documents for regulatory compliance, and these are going to be documents found, as we said before, ICH E6 Section 8. By now, you've already read through that. You're familiar with the contents of that section. And that section segments the documents based on those that are collected before the trial starts, those that are collected during the trial, and those that are collected after the trial is over. So it's important to understand at what point you need to collect certain documents as a monitor when you're out monitoring your sites. So as we're reviewing the investigator site file, we are essentially assessing the ISF for its completeness. Are all of the documents present and available? Are there any that are missing? Are there any that are not necessary? Not every document that's listed in Section 8 is going to be used in our trial, so we need to understand which ones are not required to be there and which ones are required to be there. Some of the documents that contain required signatures are going to be the FDA Form 1572. You're familiar with that form. The protocol signature page, which is the acknowledgement by the PI that the PI has received and read through and understood the protocol or the protocol amendment. Also, the investigator's brochure acknowledgement of receipt. Once again, they sign and date this, indicating that they've received and understood the investigator's brochure. The clinical trial agreement. That's essentially the contract between the site and the sponsor that's going to be signed by either the PI or it may be signed by another representative of the site, and then it's going to be signed by whoever the appropriate representative of the sponsor is. So that document is going to be there. Now, in many cases, this is a document that they probably will not have in their binder that they hand to you, because this information this document contains contractual information and budgeting information. It's normally kept maybe in a business file someplace, but you can ask to see that to verify that they have it on site. Also, the confidential disclosure agreement. This is going to be a document that is sent to the site before we enter into discussions with them. So that's going to be signed usually by the PI, maybe signed by somebody else at the site that has authority to do that, and then it's going to be signed by the sponsor representative. So once again, this CDA, it may be in the primary ISF or it may be kept in another business finder someplace. So make sure you ask for that. As we go through our review of the ISF, we want to first take a look at the documents that are collected before the trial begins, those that are listed in Section 8.2 of ICHE 6. So these could be collected during the study startup stage, and they should be on site in the ISF. You should also see those in your electronic trial master file. We've gone through all these documents during our previous lessons, so I'm not going to go through all of those here. These documents may or may not be original signature documents, which means a wet ink signature. So they could be documents that don't require an original signature, but in many cases they probably are documents that require original signatures. So let's talk about the documents that are collected during the trial. These are listed in ICHE 6, Section 8.3. So look through that section and become familiar with those documents. So this just means they're collected during and throughout the trial. These are documents that may or may not be original signature documents or wet ink signature documents. And they include documents that may change or need updating during the course of the trial. Things such as medical licenses. Medical licenses expire, and as they expire, we need to collect a new copy of the medical license, the current medical license. CVs of investigators and staff, those will be signed and dated by the staff. We'd like for those to be signed and dated within the last 2 years. So if the date of the signature is older than 2 years, then we want to get them to update their CV and provide us with an updated copy of that. Lab certifications, CLIA certificates, CAP certificates, the lab director's CV, these are all documents that will expire at a certain point in time. So if we discover that those documents have expired, then we want to collect new current documents. Also updated IRB approvals. Once the IRB approves the site for the study, that approval is good for 1 year. And then before the 1 year mark, the site has to go back and create a site status report, send that in. Normally they do that within several weeks of the expiration date so that they have time, the IRB has time to review that and reapprove the protocol. It also includes approvals of new items in the protocol, such as a new ICF, for example, or if there's any update that needs to be done that requires approval, then you'll see these documents in the ISF, and you'll just have to make sure that you've got those in your trial master file. And if you don't, collect a copy and make sure that gets to the right person so that they can import that into your trial master file. And then finally, as we're reviewing our investigator site file, we want to review the documents that are going to be collected at the completion or the termination of the trial. And these are listed in Section 8.4 of ICHE 6. So once again, these may or may not be original signature or wet ink signature documents. These are going to include documents that are collected at the end of the trial because they're used during the trial. Examples of these will be your IP accountability forms. Because those are living documents that are updated throughout the course of the trial, we're not going to collect those until the very end of the trial, once everything is complete and all the IP kits are accounted for. We'll also have IP return or destruction documentation. These can be collected during the course of the trial, or they can be collected at the completion of the trial, depending on when the sponsor wants to see those. If the sponsor allows sites to destroy IP, which some will, then as they move along, they're probably going to be destroying some of the used and returned IP as it comes back, as the subjects bring it back, and then as they destroy it, we want to collect the documentation regarding the destruction, when and where, how it was destroyed, that type of thing. If they're going to return it, in some cases, they may wait until the very end of the trial. If that's the case, then we'll collect the return documentation once it's been returned at the conclusion of the trial. The IRB closeout report. When you go do your closeout visit, one of the things you want to do is get the site to go ahead and initiate that report. So most IRBs will have a closeout report that they want the site to complete. Shouldn't take them very long to do that. They can complete that, and then you'll want to collect some sort of acknowledgement from the IRB that they received that. And then once they receive it and they review it, then they'll issue a closeout letter to the site. And so this will usually occur, long after you have closed out that site. But you'll want the site to send you that documentation if you don't already have access to it. Many of the central IRBs are going to have portals where you or someone else will have access to that, and you can go on there and pull down, for example, all of the IRB approval letters and documentation. Any notes to file that they may have created during the course of the study. These may be explanations of any missing documents that they may have. These are things that you'll collect during your closeout visit, and that'll occur, once the site has completed all their trial activities for that site. So when you're reconciling essential documents between the ISF and the trial master file, this is a process, this is a task that monitors are going to perform during interim monitoring visits by comparing the documents that are in the ISF and those that have been collected for the TMF. At the very least, monitors should perform a partial review of the ISF during each visit. It's usually a good practice to segment the review of these sections. It'll make it a little easier for you as you go along. And then you can also use your trial master file to report on any missing or expired documents. So a good thing to do is before you go out on your interim monitoring visit, run a quick missing or expired documents report out of your trial master file, and that will tell you if there's any documents that need to be updated while you're there. So you can have a listing of those. There's not going to be very many. You may have fewer than a half a dozen that are going to expire at any given point. So you can always collect fresh copies of those while you're out on your monitoring visit. So by segmenting these into sections, it makes it a little easier to accomplish this. So what I like to do is segment things like the CVs, the medical licenses, GCP certificates, IATA certificates, vendor training, site training, kind of do all of those at one point. Then you move on to your IRB approvals. That would be your IRB submission documents, your approved ICFs, your approved subject advertisements, things like that. Then you've got your lab documents, your CLIAs and your CAPs and your lab director CVs, and these types of things. And then finally, your signature pages. These will be your protocol signature pages, your IB, acknowledgments of receipt, anything that requires a signature from the PI would be included in that segment. So obviously the largest segment of those is going to be that first one that I mentioned. And normally I like to get as much of that done during the very first IMV as possible, because the more you get done early on in the site or in the trial schedule, the easier it will be as you go along. So now that we've talked about reconciling the investigator site file with the trial master file, let's move on to discussing the supervisory responsibility of investigators. So these are found in section 4.9.0 of ICHE 6. The investigator of their institution should maintain adequate and accurate source documents and trial records that include all pertinent observations of each of the site's trial subjects. So source data should be attributable, legible, contemporaneous, original, accurate, and complete. There's an acronym that we like to use called ALCOA, which attributes to each of those words in that definition. And then changes to source data should be traceable. They should not be obscure from the original entry, and they should be explained if necessary, for example, via some type of audit trail. So this is the responsibility of investigators to make sure that this documentation is maintained and is accurate. We'll get into a little more of this when we start talking about source data verification and how we compare the source data versus what's been entered in our clinical database. The supervisory responsibility of investigators also includes the following. This is found in section 4.9.4. The investigator/institution should maintain the trial documents as specified and essential documents for the conduct of the clinical trial. This is found in section 8 of that guideline, and as required by applicable regulatory requirements. The investigator institution should take measures to prevent accidental or premature destruction of these documents. So this is something you need to be talking to your sites about. One of the things that you're going to do during your closeout visit is that many sites, after a period of time, they will store these documents off-site someplace at some type of off-site storage facility. So you'll need to collect a record of when when they will do that, when they will move those records, and also where those records are going to be stored with a physical address and a phone number, in case at some later time an auditor needs to go find those records. We need to know where they are. Also in the guidelines in section 4.9.5, essential documents should be retained until at least 2 years after the last approval of a marketing application in an ICH region. That would include the United States, European Union, Japan, as well as other regions around the world, and until there is no pending or contemplated marketing applications in an ICH region, or at least 2 years of time have elapsed since the formal discontinuation of clinical development of an investigational product. So that is kind of tricky, because what the regulation is saying is that they need to be maintained for at least 2 years after marketing approval of a product, or at least 2 years after there's a formal discontinuation of development of an instructional product. The problem you have here is that in many cases there is no formal discontinuation of these of clinical development. There are products that are still have clinical trials going on, decades after the product was originally first in human studied. So, good rule of thumb is for these investigators and these sites to maintain these until they've given some sort of permission from the sponsor to destroy them. These documents should be retained for a longer period of time if required by applicable regulatory requirements or by an agreement with the sponsor. So this is the minimum amount of time they're required to keep them. That time could be even longer if the sponsor wants them to keep it longer. And it's also the responsibility of the sponsor to inform the investigator as to when these documents no longer need to be retained. And that language is contained in section 5.5.12. And then finally, upon the request of the monitor, auditor, IRB, or regulatory authority, the investigator or institution should make available for direct access all requested trial-related records. So that means that they should not be placing these in a spot where you're not able to get to them. If you ask for them, they should be able to provide those to you. If for any reason you get some resistance to do that, then you should escalate that within your study team, probably all the way to the sponsor level if necessary, because this is a responsibility of investigators. It's right there in the guidelines, section 4.9.7. So these are your reading assignments for the week. These documents are posted on Moodle, so you'll have access to them. The first document there, the FDA guidance, supervisory responsibilities of investigators, that's an article that I'd like for you to read that really kind of focuses on the guidance for investigator responsibilities along this topic that I think you'll get a lot out of. And then the guidance itself from the FDA regarding source documents and maintaining essential documents and what the responsibilities are. That will be a good document for you to be very familiar with. Then finally, you've got ICH E6, Section 8. We've been referring to that section throughout this lecture. That contains a listing of all the essential documents collected during the trial. And then finally, I've posted on Moodle an ICF contents and checklist document that you're going to use in this week's practical exercise. For your practical exercise for this week, you're going to review the documents of the investigator site file or the regulatory binder for compliance. So using the ICF contents and checklist document that I've posted on Moodle, I want you to verify that each is present in the ISF, and for the purposes of our exercise, if I've listed the document in the folder on Moodle, then that's in the ISF. So the ISF documents are found in the ISF documents folder in Moodle. And then once you've done your assessment, then I'd like for you to post your assessment in the discussion forum for this week. So a couple of things to think about. Number one, not all the documents that are listed in that checklist are going to be present. You can just indicate which ones are not present. I'd like for you to verify that the documents are current, that they have not expired. Also, are they accurate? Do they contain the appropriate information? And then, are they complete? Some of the documents may have multiple pages. Are all the pages present? Is anything out of sync? Those types of things are what you should be looking for. So this gives you a chance to review the documents that you're going to see when you go out on your monitoring visit. And then when we conclude our course and we have our practice monitoring visit, these are going to be the same documents that you're going to see in the physical ISF when you come to class and we do our practice monitoring visit. So it's a good chance for you to become familiar with those, see what they look like, see what you're looking for when you're going to be reviewing those on site. So good luck on your exercise. If you have questions, let me know, but I think it should be pretty straightforward, and I don't think anybody's going to have difficulty with it.